Hi, welcome to the hospital. There are lots of people here who want to look after you and help you stay safe. Everyone will always do their best to tell you what they're doing and why. And if you ever have any questions, you should ask anytime.
While you're in the hospital, there's some things you and your parents can do to help everyone keep you safe. When you first come into the hospital, you will have a band put around your wrist with your name and age. This is called an ID band. Someone will always check your ID band before they give you any medicine or treatment. This is to make extra sure the right person gets the right medicine or the right treatment at the right time. It's one way everyone keeps you safe. If you take any special medicine at home, have any allergies, carry an EpiPen, have an allergy action plan, or eat a special diet, make sure you tell someone when you arrive. If you're not sure, ask your parents. If you're allergic to food or medicine, your ID band will be red. The red band helps people know straight away that you're allergic to something so they can keep you safe. If you're staying at the Children's Hospital at Westmead and are at risk of anaphylaxis from food, your meal will be served on a red tray. If you're staying at Sydney Children's Hospital Randwick, your meal tray will have a green slip on it that says food allergy. Sometimes mistakes can happen. If you think you've been sent the wrong food or even the wrong medication, don't take it and tell someone straight away.
Keeping you safe from invisible germs is really important. If someone comes to visit, always ask them to wash their hands first. They can use the hand rub that's near your bed. The staff looking after you should also wash their hands before and after coming to see you. Don't be afraid to ask them, have you washed your hands?
Sometimes when you're sick, you might need to be given special medicine through a drip into your arm or leg. They do this by using something called a cannula, which looks a bit like a tiny drinking straw. Your nurse will check it every hour to make sure it's working properly. If the skin around your cannula starts to itch or hurt, or looks red or swollen, tell your nurse straight away.
When you're in hospital, sometimes you can't move around as much as you normally would. Parts of your body might start to feel sore or look red from lying still or not moving around. This can cause something called a pressure injury. Pressure injuries can also happen when something is pressing on your skin for a long time, like a piece of medical equipment. To help stop this from happening, staff will check on your skin throughout the day for pressure injuries and might need to help you move around in bed. They might even use special equipment to help prevent pressure injuries or treat it before it gets worse. If you think you have a pressure injury or have any questions, talk to your nurse.
People can fall or trip anywhere, anytime, even in hospitals. Sometimes kids get hurt quite badly. Staff at the hospital will always try and keep you safe, but you can do a few things to help them. For babies, always keep the cot rails up and locked in the highest position. The cots are higher and the floors are harder than at home. Falls can happen even if an adult is next to the cot. If you're sleeping in a bed, you should also have the bed rails up for your safety, but check with the nurse if you are not sure. If you're older and like to move around the ward or hospital, make sure your nurse or parents know where you are. You wear shoes so you don't slip. Your clothes aren't dragging on the floor. And things like your drip lines are off the floor so you don't trip. Some medication, especially after surgery, can make you feel a little wobbly on your feet. Always remember to try and keep the floor tidy and clear. We know it can be fun, but please don't stand or jump on the bed.
Staying safe is important all the time, even when you're sleeping. When in hospital, always sleep by yourself in your own bed. Your parent will have their own bed next to you, so they won't be far away. But you should not sleep with them as you might fall or get hurt by accident. Babies should always be laid down to sleep on their back with head and face uncovered. Don't place things like toys, bumpers, or pillows in the cot as it might cover their face while they sleep.
If you or your family feel like you're getting sicker, let your doctor or nurse know straight away. There is a poster near your bed that tells you what to do if you're worried. These are the 5 things you or an adult should do. Don't be afraid to reach out to us. We're here to help. Keeping you safe is important to us, but we can't do it without your help. Remember,
Keep your ID band on. Tell us about your allergies.
wash your hands.
Keep an eye on your cannula.
Look out for pressure injuries.
Be careful to prevent falls.
Sleep safely, and reach out to help if you're getting sicker.